pregnant women. It has a superior imaging quality compared to echocardiogram, easily imaging of cardiac structures which may be obscured by fat, bone, gas, etc. More accurate assessment in patients with technically limited echocardiogram, wide field of view, multiplanar reconstruction capabilities, produces high resolution and 3D images of heart and great vessels. It's gold standard imaging modality for evaluation of left ventricular ejection fraction. It's used for assessment of pericardial disease and pericardial anatomy. It's useful for diagnosis of wide range of cardiac pathologies. It's a gadolinium-based contrast material. Therefore, it's well tolerated by patients, very low incidence of allergic reaction, and have no nephrotoxic effect. Exam duration of cardiac MRI, it ranges from 30 to 45 minutes. There are different pulse sequences that can be used in cardiac MRI. They broadly can be divided into two sequences, the black blood techniques and the bright blood techniques. Spin echo, this is the spin echo. It's a dark, it's a black blood technique. It is less susceptible for metal artifact. It has a high resolution, therefore it's used for evaluation of the anatomy of heart and great vessels. On the other hand, gradient echo is bright blood technique. It's more susceptible for metal artifacts. However, its speed, it has a high, it is very, يعني have سرعة حقه كبيرة. فبالتالي it's the workhorse of cardiac imaging, and because of its speed and versatility, it has many uses. It's used for evaluation of ventricular function, blood velocity, flow measurement, valvular disease, and it's used in cardiac MRA. Another sequences which is used in heart, in imaging of the heart, is the steady state free precision. It's a group of family sequences that are the backbone for seeing MRI. They are modification of gradient echo, therefore they produce a bright blood technique. And it has a high contrast between the blood, which is bright, and the myocardium, which is dark. Therefore, it is used for wall motion evaluation and volumetric measurements. We have another sequence, which is the velocity encoded gradient echo imaging. This is used for quantifying flowing blood, and it's used in cases of stenosis. Then we have the inversion recovery. The inversion recovery is used to nail segment from the desired area and accentuate the pathology. It's usually used in delayed enhanced MRI imaging to nail the normal signal from the normal myocardium and accentuate the abnormal myocardium. Usually, it's very good, the sequences for evaluation of MI. For example, this patient with suspected MI, in these images, in the early enhanced, there is minimal enhancement in this area. On delayed enhancement, there is enhancement, in this area, there is delayed enhancement on this area, denoting that this is the diseased area, while this is the normal myocardium. The diseased area is enhancing, while the normal myocardium is not enhancing. Contrast enhanced MRI. The most widely used contrast agent is the gadolinium. The dose range from 0.1 to 0.2 millimole for each kilogram. And we have the early contrast MRI, which is less than 5 minutes, and we have the delayed MRI, which is between 10 to 20 minutes. Contrast enhanced have many uses in MRI. It's used for evaluation in cases of MI. It's used for cardiac pathologies, for example, cardiac masses. It have uses in cases of to opacify blood vessels in cases of angiography, MR angiography. This is a patient with suspected again, MI, and this is delayed enhancement MRI, two-chamber view and short axis view. There is hyper enhancement in the left ventricle, and this is denoting, again, case of MI. Standard cardiac MRI planes. Usually we know that in cases of MRI, we have the standard planes, which is the coronal, axial, and sagittal. Additional sequences that are used in cases of cardiac MRI includes the vertical long axis, horizontal long axis, short axis, and three-chamber view. This is the sagittal, coronal, axial. This is the short axis view, four-chamber view, vertical long axis, and three-chamber view. This is the vertical long axis, which is also the two-chamber view. We can see that in this plane, we can see the left atrium, left ventricle, mitral valve, anterior, inferior, and apex of the heart. The horizontal long axis view, which is also the four-chamber view, we can see both atria, both ventricle, interventricular septum, mitral, tricuspid valve, and lateral wall. This is the two-chamber, the short axis view. Both ventricle can be seen, the septum, anterior, inferior, and lateral wall. The three-chamber view, it's used for evaluation of left ventricular outflow tract, left atrium, left ventricle, aortic valve, and ascending aorta. The intra-atrial septal and the infrolateral wall. There are certain axes are used for evaluation of the great vessels, and this is called the aortic views. And this is very nice. We can see the aorta, the ascending aorta, the branches of the aorta, descending aorta, and also the heart. Contraindication for MRI, including CNS aneurysmal clips, implanted neural stimulator, cochlear implant, metallic cochlear foreign body, implanted metallic devices as gastric pacemaker, defibrillator, insulin pump, etc. And then we have metal shrapnels or retained bullets. Indication for cardiac MRI. MRI is used for in cases of coronary arteriosclerosis. It's used in cases of suspected MI for evaluation of cardiac viability, motility, to see the extent of the scar, to see complication of MI as pericardial diseases as effusion, to see if there is mitral regurgitation, and to see if there is aneurysm. MRI is used in cases of cardiac myopathy. It's used to differentiate ischemic from non-ischemic cardiomyopathy. In cases of ischemic cardiomyopathy, usually the delayed contrast enhancement will be in the subendocardium and transmurally, and usually follow vascular distribution. In contrast to non-ischemic cardiomyopathy, the enhancement will be in the mid-wall or epicardial region. Therefore, the pattern of enhancement and distribution will differentiate ischemic from non-ischemic cardiomyopathy. Also, it's used for evaluation of causes of non-ischemic cardiomyopathy as hemochromatosis, amyloidosis, glycogen storage disease, etc. Number 3, MRI plays a major role in evaluation of thoracic aortic disease. MRI usually have a great role in evaluation of thoracic aortic disease because usually it will show, for example, in cases of aneurysm, it will show the aneurysm, the extent of the aneurysm, the size of the aneurysm, the rest of the aorta, the great vessels, and the rest of the heart. It's used in cases of cardiac masses. MRI is used to differentiate thrombus from true neoplasm. It's also used to differentiate benign from malignant lesion. And also it's used for evaluation in cases of malignant lesion, the extent of the lesion. It's used in pre-procedure planning, valve disease, ventricular arrhythmia, congenital heart disease, and in pericardial diseases. In cases of thoracic aortic disease, in cases of thoracic aortic disease, usually احنا بنستخدم either CT angio or MR angio. When to use MR angio? MR angio is used in cases of allergic reaction to contrast, annual follow-up in young patients, in cases of mild or moderate renal failure when the glomerular filtration rate is more than 30, and in cases of severe renal failure, non-enhanced contrast MRI can be used to visualize the lumen, while in cases of CT, contrast is needed to depict the lumen. Now we came to case example. I think this is the most interesting part of my lecture. This is a 34-year-old man with sudden onset of chest pain. He has an elevated cardiac enzymes, ST segment elevation. This is two chamber cell view showing thickening and edema, thickening of the left of the anterior wall, of the mid and apical anterior wall, consistent with myocardial edema. Another patient, 47-year-old man. This is a three-chamber delayed enhancement. The image shows transmural enhancement in this area, which is the inferolateral wall, with non-enhancing thrombotic material. Findings consistent with acute microvascular obstruction with infarct. As I said, MRI is used for evaluation of MI complication. This is two different patients who have recently developed MI. The first one is 75 and the second one is 74. This is a true lateral ventricular aneurysm. And this is another patient with aneurysm and non-enhancing thrombus. I said that MRI is used to differentiate ischemic from non-ischemic cardiac myopathy. In this patient, the short delayed enhanced imaging in a 65-year-old man with dysfunctional dilated left ventricle, there is a linear in the myocardial enhancement, which does not follow any vascular distribution, and this is typical of non-ischemic cardiac myopathy. The result was of angiography were normal, and this is confirmed that this is a non-ischemic cardiac myopathy. MRI plays a major role in cases of thoracic aortic disease. This is a case of aneurysm of the ascending aorta, and there is consequent enlargement of the aortic annulus and aortic regurgitation. MRI is used in cases of aortic syndrome, and it has a sensitivity and specificity of 98% for evaluation of aortic dissection. See how is the antemal flap clearly visualized. So MRI plays a major role. It will show the dissection, the extent of the dissection, and the state of the branches of the aorta. And also it will show complication. This is a patient with intramural hematoma surrounding the ascending aorta and associated with bilateral pleural effusion. Another patient with penetrating thoracic ulcer. In cases of cardiac masses, MRI can differentiate thrombus from non-thrombotic material, for example, heart. For example, this patient is a man that was seen by echocardiography, and this mass was suspected to be atrial myxoma and was referred for MRI for further evaluation. This lesion was severely adherent to hypokinetic. On seen images, there was severe hypokinesia on the apex and in the septum. In early gadolinium enhancement, the mass was not enhancing, and on late gadolinium enhancement, there was enhancement of the apex and the septum, while this mass was not enhancing. Findings were consistent with acute MI and presence of thrombus. Another patient with cardiac mass, he is a 75-year-old man, and has a mass. This mass was well-defined, spherical, related to the seen in the left atrium, related to the intra-atrial septum, approximately at the level of fossa ovalis, which is typical location of cardiac myxoma. T1 weighted images showed the mass was hypointense. T2, the mass was hyperintense. On fat suppression, it was not suppressed. On gadolinium enhancement, there was heterogeneous enhancement of the mass due to necrosis, cystic degeneration, calcification, thrombus, and this is typical findings of cardiac myxoma. Another patient that was seen by echocardiogram and was suspected as a case of atrial myxoma in the right atrium and was referred for MRI for further evaluation. The mass was hyperintense on T1, approximately same signal intensity as the adjacent fat, and was suppressed by fat and shows no enhancement, and this is typical findings of cardiac lipoma. This is a patient, a young patient, who presented with cardiac tamponade due to a large mass in the right atrium. This is the mass in the right atrium. The mass was heterogeneous signal intensity on both T1 and T2 and shows heterogeneous enhancement on late gadolinium and was associated with pericardial effusion. Findings were typical of angiosarcoma, and findings were confirmed on histopathology, post-operative. This is a young patient, 25 years old man, immunodeficiency virus, and there is a mass in both atria. The mass was irregular, of intermediate signal intensity of both T1 and T2, and shows minimal enhancement, and this is diagnostic for lymphoma. In conclusion, today, cardiovascular magnetic resonance imaging plays an established role in cases of suspected many cardiac diseases. Key strengths include accuracy, reproducibility, unrestricted field of view, lack of radiation, ability to characterize myocardial tissue, thrombus, and scar. It's used for quantitative and qualitative evaluation of motion of both Doppler and myocardium. Technique, many techniques are used. Limitation, its availability, cost, exclusion of patients with non-MRI compatible devices as aneurysmal clips, and an ability to scan patients who are too breathless to lie flat or who have claustrophobia. Thank you.
شكرا للدكتورة أمال على تقديم الرائع، ونتمنى أن نأخذ للعلم الجميع، يعني هذا جديد بالنسبة لنا كراديولوجيست، ونتمنى أن نستفيد منه في المستقبل. وبالنسبة للكارديولوجيست ربما نقول لهم goodbye كارديولوجيست، وماش واحد موجود هنا، ولكن هذه حقيقة، يعني في تطور غير عادي بالنسبة لهذا المجال، وجميعنا إن شاء الله ندخل في هذا المضمار. ودكتور نشوان يكمل إدارة الجلسة.
بسم الله الرحمن الرحيم. نشكركم جميعا على الحضور والمشاهدة لهذه الفعالية. بالأمانة هذه ترجع لنا يعني الصورة السابقة وتخلينا بحسن التنظيم والاستفادة من المحاضرات الغربية، لأنه MRI الظهر قد لنا تقريبا مع الحجم المنبه وما بنمارسش كثير. إذا قلنا مواضيع ولا شيء الآن يجوز فترة وبننسى، إذا واحد ما بيش ممارسة الأمور بننسى، وإذا ما بيش ممارسة ما بيش إكسبيرينس. فالموضوع الأمان للمؤتمر كان ممتاز وأبديتنج وبروميسنج. أضيف بس نقول للدكتور شرف نحن ما عندنا شركة راديولوجية لأنه الشركة جزء من المشاركين في الانفستيجيشنز في الديفلوبمنت وكذا دكاترة راديولوجيست، حتى في الإمارات وفي بعض البرانشات بيدخلوا معنا، فاحنا كارديولوجيست كمتداخلين في بعض البرانشات، كل واحد بيساعد الثاني. next lecture.
شكرا دكتور نشوان.